I just have to interrupt you for a moment because Senate Minority Leader Chuck Schumer is up at the podium now. Let's listen to Senator Schumer.
Working families who would be hurt by Trump care. Republicans were in their lunch with Steve Wynn, a multi-billionaire who would have benefited with a huge tax cut. We're talking about average American working people. They're talking about multi-billionaires. That's why they're in such trouble. That is why they're in such trouble, because their bill is aimed at helping the very wealthy, whereas we are trying to help American families. We know the fight is not over. That is for sure. We're not resting on any laurels, nor do we feel any sense yet of accomplishment, other than we are making progress because the American people are listening to our arguments. Over the next couple of weeks, we know that Leader McConnell will try to use a slush fund to buy off Republicans, cut backroom deals to try and get this thing done. So we're going to watch this bill and all the machinations, behind closed doors as they might be, like a hawk. But the truth is, as CBO made clear yesterday, the Republicans cannot excise the rotten core at the center of their health care bill. No matter what tweaks they may add in the next week and a half, no matter how the bill changes around the edges, it is fundamentally flawed at the center. The American people don't want Medicaid slashed. They don't want help. They don't want the help they need to fight opioid addiction, to help their parents in nursing homes, to help those with pre-existing conditions, and just to help the average person who needs good health care. The American people don't want all that changed and eliminated. The Republican bill is rotten at the core. The American people are not for big tax breaks to the wealthiest of Americans, nor are they for dramatically cutting their health care. That's why the bill has about 17% popularity in America, and even Trump voters don't like it. That is not going to change with any little tweak that wins over this senator or that. No matter what last-minute amendments are offered, the bill will force Americans to spend more of their paychecks on health care, to receive fewer benefits, so that the wealthiest Americans pay less in taxes. Until Republicans abandon that rotten core, they're not going to succeed in winning the American people over, and it makes it much less likely that they'll succeed in getting a bill done a week from now, a month from now, a year from now. The ultimate reason this bill failed is because the American people just didn't like it. It's not what America stands for. Now you say, well, will you work with your Republican colleagues? We want to, and we have two suggestions. First, abandon tax breaks for the wealthy, abandon cuts to Medicaid, abandon repeal, and we can sit down and talk about improving health care. We think the ACA has done good. We're the first to say it needs further improvement. We want to sit down and talk to you about it. But we're not going to be in a position where we say, okay, only 15 million people will be uncovered. We'll support that bill. Billionaires will only get a $40,000 tax break instead of a $57,000 tax break. That's not the kind of compromise we're talking about. They really need some structural revision. And we have a second suggestion for our Republican colleagues to work with us. Abandon the closed-door, secret process they have used. Go to regular order. Have committee hearings. Allow amendments. And go back to the idea that you need 60 votes, a bipartisan majority, to pass a bill, and we can start over again and work together and try to get some improvements in our health care system. But if our Republican colleagues stick to this base bill, which so hurts working families, which so benefits multimillionaires and them almost alone, we're going to fight the bill tooth and nail, and we have a darn good chance of defeating it a week from now, a month from now, a year from now. Senator Durbin.
You know, for the last several months with the new Republican majority in the Senate and the House, we have really seen a national debate on health care. I think it was long overdue. The net result of it, today more Americans support the Affordable Care Act than at the beginning of the debate. As people reflected on what we set out to achieve with the Affordable Care Act, they realized how fundamentally positive it was for them and their families. To get rid of the problems of pre-existing conditions, to make sure that everybody had access to quality insurance, to provide Medicaid for those people who had low-income jobs and no benefits, who for the first time in their lives now had medical insurance coverage, to provide a subsidy, a helping hand to middle-income families to pay for their insurance premiums. All of these things were kind of taken for granted. Now I think people appreciate that those fundamental values and principles really are important for the future of our healthcare system. The Republicans just didn't get it from the start. They thought if they said we're against Obamacare, that's all they had to say. But the American people demand more when it comes to leadership, not just to oppose something, but to have a better idea. And the Republicans failed to come up with that better idea. They asked me my reaction today to this news from Senator McConnell. It's not jubilation, it's frankly relief. Relief for the 22 million Americans who will not lose their health insurance because of the Republican plan, including 1 million in my home state of Illinois. Relief for senior citizens who face dramatic increases in the premiums they were going to have to pay for health insurance. Relief for my rural hospitals in downstate Illinois. The heart of red section of our state that went strongly for Donald Trump. These were the hospitals that were in danger, according to the Illinois Hospital Association, of cutting back their services and their employees, and maybe some of them even closing. I feel some relief, but I don't think that this party is over. I think we're going to have to address this issue and should from this point forward. And it isn't based, as Senator Schumer said, on the bill that's been introduced. This Republican repeal bill is not some fine wine that gets better with age. It turns sour. And the reason it turns sour is because people come to understand what's included in this Republican package. They are not going to buy on to this idea that in order to give a tax break to the wealthiest people in America, we're going to cut the guts out of the health insurance and health system across this country. They want to make sure, and that's why we have the support, as we look around, of the medical advocacy groups, of groups like Heart and Lung and Cancer, and groups like the Congressional Budget Office, which that analysis did more to strike a dagger to the heart of this Republican repeal than anything else. I listened to some of my Republican colleagues who came before this microphone a few minutes ago preaching flexibility. Flexibility is not the same thing as funding. That's why Republican governors in Nevada, in Ohio, even in Illinois came out against the Republican repeal plan. They know better. You can't use flexibility to make up the difference for basic health care for thousands of people you represent in your state. I want to just reiterate what Chuck said in closing here. We are ready to sit down and work with the Republicans to make the health care system stronger. Take this tax cut for the rich off the table. Take these cuts from Medicaid off the table. Make a commitment to make sure that Americans are going to have more access to health insurance and more affordable health insurance. And I want to pull up a chair to that table. Thank you.
Senator Murray.
Well, it is no surprise that Senate Republicans needed another week or two to try to jam their Trump care bill through, given everything it would mean for families' health, for their financial security, and their own lives. We don't know what kind of backroom deals the Senate Republican leaders are going to be talking about cutting over the next 2 weeks, or which Republicans will decide they care more about towing the party line than protecting patients and families in their state. But here is what we do know. Senator McConnell is not going to give up. He wants to get to yes, and so does President Trump, even though their bill will mean that families' health care costs will go up, it will gut Medicaid, it will undermine protections for people with pre-existing conditions, and throw tens of millions of people off coverage. Why? Because they are laser focused on giving the very wealthy and big corporations a massive tax break. So here's my message today to every patient and family, every mom, dad, caregiver, doctor, nurse, teacher, anyone who believes that Trump care would be devastating for their community. Do not let up the pressure. We saw what happened in the House. We need to keep fighting, and we're going to. And Democrats will be right there fighting along with all of you.
Senator Stabenow.
I'm very proud to stand here with a group of people and in a caucus that understands that this is personal for people. It's not political. Mitch McConnell and his caucus view this as a political exercise. They started it the day after we were sworn in, doing it in a way immediately that barred any bipartisan efforts to work together. They said they'd have it done by January 27th, and it's long after January 27th, and they're still looking to put together the votes. So first, I want to thank, and I know my colleagues do as well, every single person who's gotten engaged and told their story, who has marched, who has spoken up, who has been part of prayer vigils, who have sat in offices to tell their story. This is real. When they speak about states having flexibility, well, it's the flexibility as to who they're going to cut. Grandma in a nursing home, someone with cancer, a child who can't go to the doctor. When they say they want to cut these awful rules and regulations, well, those guarantee that when you buy insurance, you actually get covered for something. Prior to health reform, you could buy a very cheap policy, and if you got sick, you found out it covered nothing, not even one day in the hospital. So we are committed to making sure that people have access to affordable health care. If we're happy to negotiate, we want to sit down and make the system better. The private exchanges need some work. Prescription drug prices are too high. Out-of-pocket costs in some areas are too high. But Medicaid works. It's saving money. It's saving lives. And we're not going to trade cutting seniors and children and families on Medicaid for another tax cut for the wealthiest Americans. That's the bottom line for us.
Questions?
You say that Obamacare and the exchanges could use some work. If Republicans do eventually take repeal off the table, what kind of reforms would you be willing to make to shore up the individuals?
Well, we've sent them a letter which listed 5 or 6. One thing, get the cost of drugs lower. That's one of the biggest costs to average citizens, to average people. Put that in there. Second, toughen things up with the regulation of insurance companies. Sometimes they raise prices way beyond what they have to, is an important thing. Third, many of us think the public option is a good idea. And some of our colleagues have certainly what we ought to do first and foremost is stop them from sabotaging the bill by making permanent cost sharing. And we're going to move to do that quickly. If our Republican colleagues want to see the system stabilized, they can't keep sabotaging it. The insurance industry itself says make permanent cost sharing and you would stabilize the markets and reduce premiums. Those are some of the ideas we have. We're willing to listen to their ideas, but it's not going to be a negotiation of how big a tax cut should we give to the rich, how much should we cut Medicaid. They've done an amazing thing. They've changed Medicaid into a very popular program. Their dramatic attempt to cut it has actually now made it far more popular with the American people, where 60–70% support Medicaid. It's one of the few good things that's come out of their proposal.
What will Democrats do during the recess and the days after to keep the pressure on?
Well, we're going to be working with, first, we are so grateful of so many of the groups that normally didn't take such pointed positions to help us. Groups like AARP, groups like the American Cancer Society, groups like the AMA. These are not very political, and they usually are reluctant to take strong positions. But this bill was so bad for their constituency that they fought it. We're going to tell them you have to keep it up. Complacency is not something that we can countenance. We have to continue letting people know how bad this is, and despite the fact that they have an amazing message machine, and so many people in America still, through some of their messaging devices, think Russia didn't try to influence our elections. On this issue, it has sunk through. When only 17 or 16% of Americans support Trump care, they are really getting the message. We're going to keep doing that.
Senator Schumer, Mitch McConnell just said you were not interested in working with him on health care. Are you interested in working with President Trump on health care?
We'll work with anyone on health care. The message to the president is we're willing to work with you in a bipartisan way, but not if the bill's core is tax cuts for the very wealthy and cuts in Medicaid that hurt average working families. To make it better, absolutely. To simply cut nursing home care, opioid treatment, fighting cancer disease, so you can give a tax cut to the rich, that's not what we're all about, and we won't be able to negotiate if they keep that as the core of their health care bill. No, we do not believe that the wealthy people in America need a tax break. We do not believe that people making over $1 million need more help than a family that has a child with cancer or a 50-year-old couple that has a mom in a nursing home. We don't believe that. I don't know why our Republican colleagues do, because it's so far away from what America believes.
Beyond the outside groups, will you be asking or urging the members of the caucus to do specific things on the recess to kind of bolster the opposition?
Yeah, we hope to have the same kind of, this weekend, over, I think, every one of us had rallies and activities in our states, and we're going to be doing that constantly from the time we go home to the time we come back.
I think that's why they haven't been able to find 50 votes yet, because of that.
I think the activity of the of the groups out there has been terrific, and I am so gratified that my caucus, from Joe Manchin to Bernie Sanders, was active in their states and throughout the country in showing how bad this proposal was, and I think it made a difference.
Senator Schumer, there's a super PAC associated with President Trump.
A what?
A super PAC associated with President Trump. Meanwhile, attacking Senator Heller in his home state, which is the state that's in play, politics question. What does it say to you that that's happening?
It just says the Republicans on this issue, from day one, Democrats have been united and on offense, and Republicans have been divided and on defense. That's because, again, the core of their bill is so out of touch with what the average American, even the average Republican, wants. And don't forget one thing, this idea of negotiations, Democrats negotiate with us. What was the first act that this Senate did? On January 4th, the day after we were sworn in, they passed reconciliation and said, we don't need Democrats, take a hike. First day back, before anything even started. That was their game plan. It's not working. Thank you, everybody.
Is there any intention of